So right now I'm doing a Kenalog treatment for what's called a hypertrophic scar. And a hypertrophic scar is an abnormal scar where the scar can get thick, red, ropey, and also raised. So this patient has the classic hypertrophic scar. And steroids such as Kenalog are the best treatment for hypertrophic scars. So we inject it directly into the scar, and over a slow, gradual period of time, usually about 6 weeks, we do see some flattening of the scar. Most patients do need a second or even a third treatment, and we can space those about 6 to 8 weeks apart. It's very safe, very low risk, and the goals are to get the redness and the raised and nodular quality flat. So most patients assume when they see a scar like this that it's a keloid, but it isn't, because keloid scars actually get much larger than this and they outgrow the margin of the original incision. So these are much more common, and scars in general can take at least a year to fade, but in this particular patient, she's already close to a year. So some people take 2 years and everybody heals differently, and it doesn't matter how I close things, it's more of a genetic thing as to how well a scar forms and how well a patient heals. So there's a certain segment here that looks great, and then these segments will gradually fade to that. It's just going to take time and more treatment. Here's a vial of the Kenalog. It's also called triamcinolone, and I dilute it to various degrees just depending on how thick the scar is.